So you have pelvic floor dysfunction, and here I am telling you your work environment's playing a role. This video is just for you. If you have no idea what I'm talking about, make sure you watch this. Hey, I'm Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. Stay tuned. All right, so you've got pelvic floor dysfunction. You actually may have incontinence, and that's the only thing you're thinking, oh, what pelvic floor dysfunction means, incontinence. And I've done other videos explain to you how that's not necessarily the case, but this video has to do with pelvic floor dysfunction and ergonomics. So I'm just gonna go ahead and stand up here. When you're sitting for extended length of time, one of two things ends up happening at the beginning, and then it's a combination going between the two. So either you stand in a neutral, in a normal standing position, you're like this, or you're like that. Whatever the case is, whatever your presentation is, this or that, that's a pelvic floor dysfunction. Why? Because it has to do with pelvis. Let's go over here, and you can see how this is your pelvis. Pelvic floor on the outside is your private part, and your anus on the outside, and on the inside is all these muscles that line the inner part of the pelvis. And anything, meaning your lower back, your SI joint, your hips, and the middle portion of your, or the lower portion of your mid back, all of those play a role in the positioning of the pelvis, therefore can lead to pelvic floor dysfunction. So when you're sitting for an extended length of time, when all of these muscles are compromised, when you cross your legs, when the positioning of this and the muscular connection between the thigh bone, hip joint, and the pelvis are compromised, as an example, all of these play a role in the positioning of this, therefore leading to dysfunction. So your ergonomics is a huge thing because you're sitting on your butt all day. And that's really messing you up, and you're so busy trying to do your kegel exercise when the first thing to do is to stop causing the problem and stop feeding the problem. Your ergonomics is the feeder of your problem, and potentially was even the main cause of your problem that's continuously feeding the problem. So if I have a leakage in a bucket and I keep pouring water in it without fixing the hole, that's not gonna fix it. If I'm fixing the hole, I add water to it, but the thing that created the hole is gonna happen again, I'm one pelvic floor dysfunction away from the dysfunction. So I wanted to do this video on that, make sure that you understand how you should approach this issue. If you have any questions or comments, make sure you contact me using the methods of communication found in the description box, or just comment right here, and make sure you subscribe to the channel. Until next time, take care.